Hello, it's Dr. Rhonda Johnson. Today is Monday, August 8th, 2022. August is National Immunization Month, and today I'm going to use this opportunity to talk about polio vaccine. Now, as you may have heard, there's been a polio outbreak in New York. New York has one confirmed person who has paralytic polio, but state health officials confirmed that the virus has been detected in 7 different wastewater samples in 2 counties, and state health officials fear that hundreds of people might be infected. Now, there's been a CDC team deployed to New York to investigate and assist on the ground and assist with vaccination efforts. So what's the big deal about polio? Well, it can cause a disabling and life-threatening disease. Now, how is it spread? It's spread through what's called fecal-oral transmission. When the stool of an infected person is introduced into the mouth of another person through contaminated water or food. Now, symptoms usually appear within 30 days of infection and can be mild or flu-like. Some people who are infected can become paralyzed or die. Now, who is at risk for polio? Who is most at risk? Those are people who have never been vaccinated for polio, people who have never had the polio vaccine, or those who have been inadequately vaccinated, who didn't get all of their vaccine doses, or those who travel to areas that could put them at risk for getting polio. Now, back to the United States, if you live in those 2 counties in New York where polio was discovered in the wastewater, please heed the recommendations of your local or state health department. Now, if you live outside of New York, should you be worried? Well, if you're an unvaccinated adult, you may want to take this opportunity to get vaccinated for polio and other vaccine preventable diseases. Now, most adults who were vaccinated as children do not need to worry about polio, but unvaccinated adults should get 3 doses of inactivated polio vaccine. That's usually given the first dose, then the second dose is a month to 2 months later, and a third dose 6 to 12 months after the second dose. Now, unvaccinated babies should be vaccinated as soon as they turn 2 months of age. And folks, if your children are behind on their polio and childhood vaccinations, please get them caught up as soon as possible. Now, as always, please check with your doctor for your specific medical questions. And again, if you live in that 2-county area, follow your state and local health department recommendations. That's my message today. Please be safe and take care.